Welcome to the Doctor's In. I'm Dr. Freddie Gomez. We want to make the most out of your telemedicine appointment today, so send in your questions and we'll do our best to answer them. As more quarantine restrictions are lifted, let's revisit how the coronavirus can be transmitted through droplets. A group of researchers from Finland created a video simulation showing how viruses like COVID-19 can easily spread indoors when one person sneezes or coughs. Let's watch this. The neon green cloud represents aerosol particles coming from a person who coughed or sneezed. Look at how viruses or bacteria can spread from one aisle to another. And this is also a reminder for people who are not well to stay at home or maintain physical distance from others. Everyone else should practice social distancing. Hindi nakikita ng mata ang mga virus kaya kailangan mag-ingat saan man tayo magpunta. To help us understand droplet transmission, we have Dr. Kristofrank Bryant Pioquinto, who is an internal medicine specialist and head of wellness at the Los Santos Medical Center. Hello and welcome to the show, Dr. Frank.
Hi, good afternoon, Dr. Freddie.
Now, before we discuss further, ano ba ang respiratory droplets, Dr. Frank?
So, respiratory droplets are droplet particles that are 5 to 10 micrometers in diameter, and they are referred to as respiratory droplets. Ang less than 5 micrometer is tinatawag nilang respiratory nuclei. And according to the current evidence, COVID-19 virus is primarily transmitted between people through respiratory droplets.
Okay, so just for a point of reference, no, para sa mga viewers natin, ang micrometers po ay napakaliit. Yung kapal po ng buhok natin is around 9. So virus is around 2 micrometers thick. So nakita natin na Dr. Frank sa video kanina how viruses can spread easily indoors. Bakit mas mabilis kaya kumalat kapag ganito ang sitwasyon?
Well, actually, sir, Doc, it depends on the mode, no? Kung for example, speaking lang, mahina yung spread. Pero kung sneezing and coughing, mas malakas yung force, so mas mabilis yung spread. And when indoors kasi, wala tayong yung park air na direction. So, pag ganun po, mas mabilis talaga mag-spread yung droplets.
You mentioned also, Dr. Frank, about yung speech, ano? So, is it true that droplets from speech can float in the air ng mas matagal?
Well, it depends on the size and the consistency and the composition of the droplet. No? The bigger droplets usually last a few seconds lang, hulog na agad. Pero kung maliliit yung droplets na yun, they can stay in the air longer.
Okay, now let's answer some of the social media questions we have. We are talking about how viruses spread through respiratory droplets, just to remind everyone. We have a question from John who is asking, recently nagbukas na ang ilang malls at ibang establishments. Safe na po ba pumunta rito?
Hello, John. Thank you for that question. Well, right now kasi hindi natin alam kung sino ang may COVID-19. No? There are some patients na asymptomatic. So, for me, as much as possible, ang pinaka-safe is to stay home. Kung kailangan niyo talaga pumunta ng mall, wear protective equipment na lang. No? Like the mask, kung mayroon kayong face shield, pwede, or use glasses, yun.
And also, if they do decide to go to the malls, to not linger around. Kumbaga, kung meron kayong kukunin sa mall, bilhin nyo na and then go back home kagad. So hindi pa tayo nandun sa normal na a mall is a place to pass time. We have another question from Marian. Ang tanong ni Marian, my company provides a service to pick me up from home and I have co-workers with me. How can we be safe from viruses inside the vehicle?
Okay, so before entering the car, make sure na disinfected yung car. Okay? And then when in the car, practice physical distancing. Always wear a mask or wear yung face shield. And then if possible, better not to talk. Don't talk to anyone there. And then if you have coworkers that have signs and symptoms of COVID-19, better na i-advise sila just to stay home and quarantine. Huwag niyo muna silang papasukin.
And a question from Glad. Nakakatulong po ba ang pagsuot ng gloves tuwing mag-grocery or mamamalengke to prevent contracting or getting the virus?
So glad. One of the modes of transmission of the virus is direct contact. No? Of course, nakakatulong yung gloves kasi gloves will prevent direct contact. Pero remember, your skin is also a protective layer. No? So, just as long as pagdating mo sa house, you wash your hands for more than 20 seconds, okay naman. Pero yes, gloves will help.
Okay, we have to pause for a quick break, but when we return, we'll answer more questions about the transmission of COVID-19. Stay tuned. We'll be right back. Welcome back. This is The Doctor is In, and I'm Dr. Freddie Gomez. We want to make the most out of your telemedicine appointment today, so continue to send in your questions. COVID-19 is primarily transmitted between people through respiratory droplets and through the contact route. The COVID-19 virus is small, smaller than bacteria, and can travel via a person's cough or sneeze up to distances of up to 6 feet or 2 meters. Kaya ang palaging paalala ay to observe proper social distancing. So we will continue our discussion about respiratory droplets and how they can spread COVID-19 with still Dr. Frank Pioquinto na isang internal medicine specialist. Dr. Frank, alam ng marami na ang pag-ubo o pagbahing ng isang taong positibo sa COVID-19 ang isa sa mga pangunahing paraan ng pagkalat ng virus. Ano po bang mga ibang paraan sa pagkalat nito bukod sa ubo or bahing?
Well, yung sinabi niyo na kanina, no? Direct contact. Pag at pwede rin po sa mata, and then pwede rin po yung mga like cellphones. Like if for example a COVID-19 patient will use a cell phone and then you share it your cell phone with another person, pwede yun kasi fomites po or objects na has the virus can spread the virus.
Tama yun, Dr. Frank. I agree with that. And there was a recent study also on the different times in which a COVID-19 virus can remain active in certain fomites like what you said. No? So iba yung time frame sa karton, iba sa mga stainless steel, and so forth. So the most important thing to do is like what you mentioned earlier, is to disinfect your objects, the things that you hold on most of the day or things that you hold frequently, just like your cell phone, like you mentioned. Now, there was a recent report in Washington, USA, of a pastor who was infected with COVID-19, and his infection was linked to him holding a Mother's Day live stream service, which included a choir and singing. So, Dr. Frank, could singing be a driver for the spread of the virus?
Anything that creates respiratory droplets, so talking, singing, sneezing, coughing, can spread the virus.
Okay, so although further studies need to be done, but uh, I bring this up because a lot of people are still, of course, all of us during these quarantine times, we want to do the things that we are used to doing. And one of that is going to church, hearing service, hearing mass, hearing pastoral services, or whatnot. This is just something that should be in the minds of many who want to go into religious gatherings of service, that singing could be a way. So if there is a way to observe these religious practices, but hold off maybe on the singing, maybe it could be a little bit safer. What do you think, Dr. Frank?
I agree with that. And if you go to church, better wear face mask, face shield, and if your church has good ventilation, that is also one way to prevent the spread of the virus.
Okay, now it's time to answer some of the social media questions. We have one from CY. Advisable po ba yung mask with face shield tuwing lalabas ng bahay? Dr. Frank? Okay, I think we lost our connection with Dr. Frank. But with this question, it's about using a mask and face shield tuwing lalabas ng bahay. One should be wary about the norm, the new norm that we have. Ano? So some people might say na over naman ito to wear a face shield aside from a mask. It depends on the person. If the face shield is readily available and you're comfortable wearing it, then okay. But in reality, a face mask is should protect you enough already when you go outside. But one thing to note, no matter what you have, face mask, a face shield, or everything, nothing is 100%. Nothing is 100%. All of these will reduce the risk of you getting COVID-19, but whatever mask or however expensive your mask is, it reduces the chances, but it doesn't protect you 100%. So that's something to think about. Okay, so we have Dr. Frank back on the line.
Hi, sorry. So I totally agree with you there, Doc. There is no 100%, pero the more protection that we give ourselves, the better. No? And the best protection is to just stay at home.
That's right. Now, before I read out the next question, we'd like to say hi to our viewers from Tagum Leyte, Cagayan Valley, Negros Oriental. Okay, I just lost my list. Okay, from Negros Oriental, Metro Manila, and also to our audience abroad from South Africa, Qatar, Tokyo, Saudi Arabia. Okay, I'll ask my staff to stop texting first. Saudi Arabia, Kota Kinabalu, Chicago, USA, India, Singapore, and Lebanon. Thank you very much for watching. The doctor is in. Okay, we have another question from Kimberly. Ilang beses po dapat gamitin ang reusable face masks? That's a good question. What do you think, Dr. Frank?
Reusable face mask. So as long as uh, na-disinfect siya, and as long as yung mga yung fibers can filter out the droplets, pwede pa rin gamitin yun. No? Pero kung malalaki na masyado yung spaces between the uh, the the mask, ang problem dyan is baka lumusot lang yung droplets, so hindi na siya safe.
All right. So we also have another question from Julius. Ngayong may modified enhanced community quarantine na, can you mention some preventive measures para mas safe sa COVID-19?
Okay. Ang pinaka-safe po talaga is stay at home. Okay? So, uh, others, well, eat healthy. No? Take vitamins to boost your immunity. Uh, Exercise at least 30 minutes a day. Get enough sleep. Reduce your stress. And do not take any unproven medication. No, please do not believe everything that you hear in social media. And if you have any questions, po, ask a doctor.
I think those are very important advices that you gave. So there is still no cure for it. So but a lot of people might be tempted to believe one a cure or one remedy might be effective with this COVID-19, but till this date, there is still no medication, nothing that you can take, nothing that you can buy, which will guarantee even a chance that can cure you from COVID-19. So thank you very much, Dr. Frank Pioquinto, for joining us today
Yes.
and sharing those very important advices that you can give our viewers.
Okay. Thank you. Bye.
So when we return, we'll discuss how viruses threaten our lungs. All that more when the doctor is in returns. Welcome back to The Doctor is In. I'm Dr. Freddie Gomez. Coughing is an important reflex that helps protect your airway and lungs against substances na pwedeng pumasok sa ating baga. Ang lungs ay isa sa mga pinaka-importanting parte ng ating katawan, but it can be exposed to a lot of health risks. So to give us a better appreciation of how our lungs work, we'll be joined by Dr. Lenora Fernandez. She is the head of the pulmonary services at the Asian Hospital and Medical Center. Welcome to the program, Dr. Fernandez.
Thank you, Dr. Freddie. Thank you for inviting me into this program.
We're glad to have you and your wealth of knowledge to be shared to our viewers today. Now, Dr. Lenny, what effect can respiratory viruses and bacteria in general have on the lungs?
How they enter the lungs or how they affect the lungs. So the viruses.
What is the effect? What is the effect that respiratory viruses and bacteria? What effect can they have on the lungs?
Oh, they can definitely affect our lungs tremendously. For example, the COVID-19 virus can go usually through the nose or through the mouth. They lodge in the throat, or sometimes if there's a heavy load of the viral particles, if there are a lot of droplets which would come in, they can go straight into the lungs, and then they pass through the bronchial tubes and go into the air sacs. So the bad thing about our SARS-CoV-2 virus is that it can really latch very well to the throat and into the air sac cells. And when they lodge there, they can do a lot of damage already if they would invade the cells. And when they invade the cells there, they unleash a lot of inflammatory substances, which we call the cytokine storm. It can damage the lungs a lot and cause even death for some patients where their lungs basically would not work anymore.
Now, based on symptoms, let's talk about symptoms now, Dr. Lenny. Ang symptoms ba ng COVID-19, ang isang taong positibo sa COVID-19, may pagkakaiba ba ang simptomas na pwede niyang ipamahagi compared to sa isang taong hindi COVID-19 ang problema ng baga? Let's say, just like a regular bacterial pneumonia. May pagkakaiba ba ang symptoms ng dalawa? Meron bang way na masabi mong, oy, COVID-19 nga ito kumpara sa hindi?
Dr. Freddie, ito yung problema natin, no? There's no difference that we saw in the symptoms among those affected with COVID and those who are not. So basically, lahat ng may ubo, sipon, hinihingal, or lagnat, or even trangkaso lang po pwede po yung COVID-19 na infection. So very important po na kapag meron kayong sintomas, ay magsasabi kayo sa isang healthcare personnel, sana makakonsulta, kung pwede, diretso po yan sa emergency room kung magper-persist. Kung hindi, kailangan i-isolate mo yung sarili mo habang meron ka nung sintomas na yon. Kasi we cannot differentiate between the two, or the COVID-19 infection from other kinds of respiratory infections.
Yes. Now, ngayon na nandyan pa rin ang threat ng COVID-19, no? Nandito pa rin, it's part of our new normal that COVID-19 will be with us, and it's not going to go away anytime soon. Aside from COVID-19, we have other respiratory diseases to look out for, not just this virus. In general, how should a person take care of their lungs?
So a person to take care of his lungs should have adopt what we call a healthy lifestyle, no? So you get a good night's rest, you eat well, and then in case you have symptoms, then you stay at home, you isolate yourself, and probably do a telephone consult with a medical doctor or other healthcare personnel. So like here in Asian Hospital, we have called the e-consult. You can log on to the website or go to asianhospital.com. And very important, of course, is not to be exposed to smoking, not to smoke, or the others around your place should not smoke as well. And of course, lead a healthy lifestyle. So at least with the modified ECQ, we're now able to do some exercises or physical activity outside our houses, but of course, still practice social distancing when doing so, and try to still wear a mask even when you're doing your physical activities.
That's good. That's great advice, Dr. Lenny. Now let's answer our last set of social media questions. Our first question is from Donna. Bakit po nahihirapang huminga ang tao tuwing may ubo?
Ang dahilan kasi ng ubo iba-iba. So kung yung dahilan ng ubo ay halimbawa hika, no? Nagsisikip yung tube. It's now shortness of breath kasi kulang yung
Okay.
hangin. Iba section tulad ng COVID-19. Dahil sa COVID-19 halimbawa, so naiipon ang plema doon, nagbabara din yun sa pagpasok ng oxygen sa katawan. So that now creates again yung hingal or shortness of breath. Now minsan din kapag ikaw ay inuubo, sunod-sunod yung ubo. Usual nating hininga ay hindi nagiging napapanatili. So the regular breathing is impeded by the bouts of coughing, and that also sometimes causes shortness of breath. Now remember, there are also other illnesses which can affect the lungs like heart failure or heart attack. Naiipon yung halimbawa yung tubig dahil hindi maganda yung function ng puso pumupunta sa lungs. So yun din, nagki-create din po ng hingal. So hindi po din lahat ng hingal or kahirapan sa paghinga nor coughing are due primarily to a lung problem. It can be a manifestation of other diseases. So medyo mahirap po talaga, pero nasa unang isip natin po syempre sa ngayon ay yung COVID-19. So we're imploring all our patients na if you do have cough or shortness of breath, if it's really you think an emergent thing, then you have to go to the emergency room for that. Pero kung sa tingin ninyo, hindi siya ganun kalala, then isolate yourself. You can do a telephone consult first with your healthcare practitioners para maiwasan po ang pag-spread din po. So ito po yung this is what we are trying to disseminate, na try to consult first.
Okay, we lost Dr. Lenny there for a second, but while we're trying to get her back, what she was trying to say is ang gustong pahiwating ni Dr. Lenny is maraming rason kung bakit ang isang tao ay nauubo, pero pinaka-importante ay wag na po tayo magbakasakali, pumunta kagad or magpa-check up kagad sa doktor. Ngayon, siyempre, nag-iilang tayo sa pagpunta sa ospital or sa doktor. there are other ways to do it. Let's take advantage of the technology that we have right now. There are a lot of doctors who are online. You can get a doctor's appointment via online. Okay, we have Dr. Lenny back on. Back on. Okay, Dr. Lenny,
Yes, Dr. Freddie.
Dr. Lenny. Yes. Thank you so much for joining us today. Do you have a final message for our viewers?
Yes, so please observe our physical distancing, our social distancing. Keep yourself healthy, keep yourself safe. And again, if you have some respiratory symptoms like cough, shortness of breath, or fever, or you think you have like flu like symptoms, please do your consult either physically through the ER, or if you need to, you need to seek a consult physically. Otherwise, do it virtually. You can do an e-consult like here in Asian Hospital. We have our website, theasianhospital.com, or we have our 24/7 hotline, 8771 9000. Thank you.
Okay, thank you very much, Dr. Lenny Fernandez, for joining us today. At sana nasagot namin ang inyong mga katanungan. Samahan niyo kami ulit bukas 3:30 p.m. on The Doctor's In, only here on CNN Philippines. I'm Dr. Freddie Gomez. Stay safe, everyone.